Serious acid reflux can lead to damage in the esophagus, inflammation that we can see, and over time, this can lead to tissue change known as Barrett's esophagus, which can be precancerous. Hello, I'm Dr. Wang Tien. I'm a gastroenterologist. I practice gastroenterology in Gleneagles Hospital. Acid reflux, also known as gastroesophageal reflux disease, is a disease where too much acid in the stomach is going into the esophagus. It can cause heartburn, regurgitation, or even chest pain. Now, when the patient first gets the symptom and they see the doctor, one of the first things we want to establish is to make sure that this is not due to other more dangerous problems, for example, cancers, ulcers, that can have very similar symptoms. So one of the very common tests that will be offered to the patient is a gastroscope. This is basically using a very thin and flexible tube to put it down the mouth and look into the esophagus and the stomach. In serious reflux, we often see esophagitis or inflammation of the esophagus, and over time, this can lead to Barrett's esophagus, which is precancerous. With this, we often treat the patient with a combination of lifestyle and medications. Now, in instances where this is not enough to help the patients, then we will offer additional tests. We call this the reflux test. Broadly speaking, there are two types. One is called wired. It involves putting a tube down the nose, and unfortunately, this has to be done with the patient awake. The tube goes all the way down to the stomach, and we have sensors on the tube that can measure the amount of reflux over 24 hours. It is what we call the gold standard or the most accurate test. Unfortunately, a little bit uncomfortable. There is an alternative, which is called a wireless pH capsule, and the good thing about this is it can be done with the patient asleep. In fact, we do it very often during the first scope. After we check, we don't see any serious reflux, we can then attach this very small capsule, about the size of a vitamin capsule, to the lower part of the esophagus by just clipping it there. And this capsule will stay there for about a week, during which time we can measure acidity for up to 4 days. The data is transmitted wirelessly into a small recorder that they carry with them. The capsule passes out through the stool and there's no need to collect it at all. So this study can also tell us when they're experiencing the symptom, at that exact moment, was there a reflux episode happening. The ability to detect this can then confirm whether or not the symptom is really due to reflux and can direct treatment. So if you have serious or persistent reflux, do see a doctor. You may benefit from some of these tests.